Hello everyone. I hope you all are doing great. Today I'm back with my new video presentation and the topic includes barium studies. So in very brief and in short, I'll be discussing the significance and procedures for the barium studies. So let us begin first with the definition. What are barium studies? So these are basically a radiographical examinations which are done for the GIT to diagnose abnormalities like tumors, strictures, hernia, polyps and ulcers. Now the question arises that why we are choosing barium. Because barium is radio opaque, it has very high atomic number and molecular weight, it has high density, non-toxic, since it has to be ingested, so it is a very good property of barium that it is non-toxic in nature. Then it coats the mucosal lining of the GIT, making the shape, contour, and patency of the hollow organ visible on X-rays. Now, barium studies done for the various regions of the GIT, they are named differently. For example, if the study is done for the pharynx, esophagus, and up to the level of esophagus, then the name of the study will be known as barium swallow. Now, there are various indications for which the study is done, which includes dysphagia, that is difficulty in swallowing, stricture, esophageal carcinoma, hiatal hernia, that is protrusion of the stomach into the esophagus, achalasia cardia, that is neuromuscular incoordination of the muscles of the pharynx, and zincus diverticulum. There are also few contraindications for which this study is not done, that is TEF, that is tracheoesophageal fistula, which is a congenital anomaly, and also if there is recent biopsy done, then barium swallow is not done. Now the procedure. Before the procedure, we'll ask the patient to come up with some preparations, like he has to be empty stomach or fasting 6 hours before the procedure. Now, on the day of procedure, he's asked to drink 20 ml of barium solution, and after that, the fluoroscopic images are taken while the patient is deglutenating. These images are taken in various views, which include anterior posterior view, right anterior oblique view, and left anterior oblique view. These all views will make the esophagus more clear. Moving to the X-rays. So here we see the image, radiographic image, after the barium suspension has been swallowed by the patient. So this hollow muscular tube, which we can see over here, which is coated by the barium suspension and appearing white, is the thoracic part of esophagus. So if you see this clearly, this is thoracic part of the esophagus, and this is the anterior posterior view. Rest of the bony landmarks also we can clearly see in this AP view. Then moving on to this side, over here we can see more clearly the cervical part of the esophagus, and the barium coating has lined the mucosal lining of the esophagus. Behind, we can appreciate the vertebrae with their bodies and spine. So these are various views in which barium swallow images are seen. Now moving on to the next investigation, which is barium meal. Now, barium meal is a radiographical study of lower esophagus, stomach, and duodenum. Now, there are various indications also, which includes dyspepsia, weight loss, abdominal mass, and partial obstruction. Contraindications will include large bowel obstruction. For that, we will not perform barium meal investigation. Now, the procedure for the barium meal investigation will be, again, we'll ask the patient to come empty stomach 6 hours before the procedure, and on the day of the procedure, we'll ask the patient to drink about 150 to 200 ml of barium suspension solution. After this, the intake of the solution, the radiographic images are taken, and the radiographic image for the barium meal will appear like this. So over here, we can see this one is the lower end of the esophagus, or we can say abdominal part of the esophagus, cardioesophageal junction, and whole outline of the stomach if we see clearly. Lesser curvature, greater curvature, this black color, which is gas bubble or air bubble, representing the fundus of the stomach. Then lies the body of the stomach, and over here lies the pylorus part of the stomach. Then pylorus will end into the first part of duodenum over here, will further continue with the second and third part of the duodenum. So this study is done till the first or the initial part of the duodenum. So over here we can see this region, it is triangular in nature, and this is also known as duodenal cap. This duodenal cap is very important from examination, or it is a characteristic landmark which has to be remembered and kept in mind. Now this one is, since this is the pylorus of the stomach, it is protruding into the first part of the duodenum, making it making it appear like triangular area. So it is also, that is why it is called as duodenal cap. Also over here in this region, the first part of the duodenum, the circular folds are very poorly developed, so giving up this appearance. The rest of the part of the duodenum will appear floccular or feathery in appearance, which can be seen here. So this is how the image of the barium meal will appear, where most importantly we are observing the region of stomach and duodenal cap. To visualize the small intestine, we'll do another investigation which is known as barium meal follow-through to visualize the mucosal lining of the small intestines. So indications for which we perform this investigation is Crohn's disease, Hirschsprung disease, which is also known as megacolon, ulcers and tumors. Now again, before the procedure, the patient is asked to come up with some preparation, that is to stay empty stomach 6 hours before the investigation and few laxatives a day prior to the investigation for the gastric clearing, so that any fecal matter does not obscure the images of the intestines. Now the procedure. The patient is asked to drink 500 ml of barium suspension solution orally, and series of x-rays are taken at every 30 to 40 minutes until we observe the ileocecal junction. So this is the procedure of the barium meal follow through, and the images of the small intestine will appear like this. So above, if we see again, this is stomach, duodenal cap, and these are the intestines. Now if we see clearly on the left and upper side of the peritoneal cavity, the jejunum, coils of jejunum appear floccular or feathery in appearance. The reason is that it has very well developed transverse circular folds, making it appear like floccular or feathery appearance. Whereas in the lower and the right end, we see the homogeneity of the barium suspension solution with narrow and filled lumen. So this represents the coils of ileum. So we should remember that left and upper side of the peritoneal cavity is occupied by jejunum. Characteristic feature is that it appears floccular or feathery in appearance due to well developed transverse circular folds, whereas lower and right end is represented by coils of ileum. So this is how the image of the barium meal follow through will appear in the radiographic image. Moving on to the last investigation, that is barium enema. And this is done to visualize the large intestines, means ascending, transverse, descending, sigmoid colon. The indications will include colonic tumor, diverticulitis, polyps, and anatomical abnormalities. Now, the contraindications for barium enema will include chronic obstruction or if there is any recent biopsy done. Now, the procedure for the barium enema is very different from the procedures we have done till now for rest of the barium studies, because in this barium enema study, we'll ask the patient to lie down on an examination table, and barium suspension solution is inserted through rectal tube, which is further inserted from the anal canal into the rectum, so that barium solution, it reaches the intestine until till the ileocecal junction. Now, the mucosal lining of the colon is visualized using fluoroscope and X-ray images are taken. So, once the solution reaches the ileocecal junction, then the rectal tube is taken back and then the images are taken. Now, how the large intestine appears in the barium enema images, radiographic image, we can see that the very key feature of the large intestine is hostrations. So we can easily identify that this image is of barium enema because large intestine is clearly visualized in this image. So what are the various parts of the large intestine? So lower part here will be cecum, followed by ascending colon, then this bent because lies on the right side, also called as right colic or hepatic flexure. Transverse colon, splenic flexion, descending colon, which will continue as S-shaped sigmoid colon, followed by rectum and anal canal. So this is how we visualize the large intestine through the barium enema. So I hope this video was slightly helpful for you to identify the various barium studies and to learn their significance. Hope to see you in the next video very soon. Thank you very much.